Before the floodwaters fully receded in mainland China, the epidemic returned. On August 19th, China's National Bureau of Disease Control and Prevention said that the new mutant strain of COVID-19, EG5, has formed a dominant epidemic in most provinces, growing from 0.6% in April to 71.6% in August. Authorities say this trend is likely to continue for some time. Recently, netizens from all over China have been posting reports that people around them have been infected with sanyang, which means the third time being infected with the new coronavirus.
These 2 days, it feels like the number of patients is going up. There are many, many patients. Usually we have about 20 to 30, but in the past 2 days, it has been close to 140 to 150. Doctors have been working very hard. It seems to me that at least every hospital in Shanghai has a lot of patients in their fever clinics. Yesterday, I met our doctor who communicated with me after work. He told me a patient from Puxi came to Pudong because our hospital was in Pudong. The doctor was curious and asked him why he came from Puxi to Pudong because there were many hospitals near his home. The patient said that he called around to ask which hospitals had fewer patients in their fever clinics so that he could avoid the rush. And he ended up telling us that ours was considered to be the one with fewer patients, which is ridiculous. Anyhow, it seems to suggest that it is not just us who have a lot more patients, but every hospital is experiencing a surge.
Following the floods, many victims in northern China, including some who had lost their homes and are still living outdoors in tents, are reportedly infected by the outbreak.
Now I'm in a community hospital in Handan City. I'll say it again, a community city hospital. It is not a big hospital or a central hospital, the number one hospital, the traditional Chinese hospital, or anything like that. It is not the first or second tier hospitals. It is just a community hospital. I see that a lot of people come here with the children to see the doctor, and adults too. Doctors are all hands on deck. I feel that the third wave of COVID-19 or sanyang has begun. Some are already infected, and some have already been spreading it. That is, family members have it and then spread it to other people. I don't feel optimistic this winter. Everyone, be prepared and protect yourself against this epidemic.
Hello，大家好，北京。大家看我现在
Look, I'm wearing this mask again to go out. My sister told me that after the flooding in Heilongjiang province, sanyang was everywhere. She had a high fever of 38 Celsius or 100.4 Fahrenheit. Our outdoor friends have been affected for the third time too. They said they felt very sick. That's why I started wearing the mask again. 2 days ago, I saw a video that in Shanghai there were many sanyang patients in outpatient clinics. People say that after a big disaster, an epidemic will usually follow. After this flood, there will be a surge in the epidemic. But now I don't know what to make of the experts. Some hospitals mentioned a virus of G5 or something. I don't know the professional term, but this virus would cause sanyang in a large number of people.
最近吧，三阳又开始了，朋友们。
Sanyang has started again recently. Friends, when you go to the hospital or crowded places, it's recommended to wear a mask.
我不是前2天刚从东戴河回来吗？
I just came back from Beidaihe 2 days ago, right? When I got back, I had been sniffing and sneezing for the past 2 days. I thought I caught a cold, and I researched online. It said that in Beijing, 70% of the people are experiencing sanyang, getting infected for the third time. I have been infected 2 times. I'm afraid it's going to be my third time.
The return of the epidemic in China has caused hospitals to be overcrowded. Many young children have shown symptoms like high fever, white lungs, difficulty breathing, and a loss of appetite. It's like the symptoms of COVID-19. However, hospitals no longer call it COVID-19, but refer to it as mycoplasma pneumonia instead. Many people suspect the authorities are covering up the outbreak by changing the name of the virus. This is the Suzhou Children's Hospital at 9 a.m. It's packed.
We finally got home. My daughter has been sick for almost a week. It was a very serious lung infection. At the beginning, it was just a common fever. After I gave her some medicine, her fever went down and she was completely fine. But the next day, she started to have a recurring fever that wouldn't go away. With medicine, she would be good for 3 or 4 hours. But after the medicine wore off, she would have repeated fever, coughing, shortness of breath. The doctor checked her blood, which was negative, and then listened to her lungs. We were told they were okay and we could go home, just keep an eye on her. But when we got home, she had high fevers again. The next evening, we had to take her to the emergency and insisted on a CT scan to have her blood checked. It turned out she had a very serious pneumonia and her cough was serious. She was getting short of breath, had no appetite, and her lips started to turn a little purple. In the early morning, we rushed to have her admitted to the hospital. The hallways were full of children with this kind of pneumonia and had no appetite. They can only eat a little bit. The child in the next bed didn't eat or drink for 2 days. This virus was too much. After 3 days of injection, my daughter finally got a little better and slept better with less cough at night. A reminder, if you have a child with weak immunity, pay attention to the symptoms. If a kid has high fevers that won't go down, shortness of breath or cough, go to see the doctor right away. We haven't been discharged from the hospital yet. During the day, we go to the hospital for injections, return home at night, and go back the next day. Now the child's spirit is slowly getting better. People from the next hospital bed said that if the adult's immunity wasn't good, he or she would get infected too. So it hasn't been smooth lately. Let's watch out for it.
Greetings. I haven't seen everyone for a while. Recently, our family of 3 experienced Son Young being infected with COVID for the 3rd time. A lot of people are concerned about the symptoms of Son Young. Let me tell you, if there are elderly people and children in the family, you have to be especially careful as Son Young is even more serious than Young. Being infected for the 2nd time, it has all the symptoms of Young, plus swelling and soreness in the throat. Following my son's 3rd infection, the symptoms are a bit more serious than the 2 previous infections because his throat was sore and he couldn't eat anything even though he wanted to. He could only cry, plus he had a bad fever too. At the beginning of 2023, the CCP downgraded its management of COVID-19, only adopting measures meant for Class B infectious diseases. Quarantine measures are no longer practiced. Outpatient clinics don't test for COVID-19. Close contacts are no longer assessed. No more designation of high and low risk areas, and asymptomatic and mild cases are advised to stay home. Since there is no data on the outbreak, there is no way to report a resurgence of the epidemic. There are no treatment manuals for EG5 infected cases, so doctors can only advise people to wear masks. The doctor said that you got COVID, but there was no special good solution, and there was no need to quarantine. That is to say, between family members, just wear a mask and be cautious. There is no special or effective medicine. You have to fight it yourself. Hospitals don't seem to be treating it anymore. Now, I am waiting for the results of the blood tests. Since the hospital doesn't treat COVID anymore, what's the point of having a fever clinic? We were sent from the emergency department quite far away from here to the fever clinic.
That doctor I just saw was funny. He dismissed me in 2 or 3 minutes. I said, I just wanted to know if it was COVID, so I could watch for it. Guess what the doctor said? He said that even if it were confirmed, the hospital wouldn't treat it. Just go home and wait. There's no effective treatment or medicine nowadays. Just drink more water and wear a mask at home between family members. And there's no quarantine. Don't you find this overly simple? If that's the case, I'm confused. What's the point of having a fever clinic at the hospital with a whole bunch of staff here? Many of us were sent here, but now the hospital doesn't treat it. How do you make sense of this? Even at the emergency rooms of the hospitals, they can at least treat common colds.
Sanyang cases have begun to rise, that is, being infected for the third time. I used to talk a lot about Yang being infected for the second time, but now a lot of people have begun to say that they got Sanyang. You can read the comments section or online forums. Many people in the hospitals have begun to get Sanyang because COVID-19 has mutated again, and it's mutated into EG5, which should be a mutation of XBB. I am vigilant about this because I have a bad trachea. I've been watching out for the second infection, but now it's about being infected for the third time, Sanyang. I think Sanyang is a state where you may get well quickly after symptoms appear, but it becomes a vicious cycle. Your immunity or immune antibodies have begun to drop after each infection. It'll start taking less time for one to get infected. Normally, one wouldn't be infected again within 6 months after the first infection, but now everyone is saying they are infected for the third time. It means people's immune system has weakened, so everyone needs to pay attention to it. How can you say that the virus has left? I am surrounded by several friends who are infected for the third time now. Some are older, some younger. There is no difference in being affected, although the symptoms might be different. Some are mild and some severe, depending on the person's physique. People used to get scared with the mention of COVID-19, as last year. Now, people aren't as scared, and there is a level of tolerance in their minds. Still, people need to stay vigilant for the virus. People don't think it's that serious anymore, but it's not necessarily true. Everyone's symptoms are different, especially if you have elderly members in the family. Be extra cautious. Now people don't wear masks when they go out, and they don't have the same level of protection as they used to. Think about it, everyone. When we first got infected, it was about 6 months ago. It wasn't that long ago, or rather, the virus has never left us at all. At the end of April 2023, the Centers for Disease Control and Prevention in China published a study. It's estimated that between December 2022 and February 2023, more than 82% of the people in China were infected with COVID-19. The current primary strain found in China, EG5, is the Omicron XBB series variant. The infection has increased from 0.2% in February to 83.6% in early May. Symptoms include fever, cough, headache, sore throat, nasal congestion, body aches, and weakness. On the social media platform Douyin, the Chinese version of TikTok, several posts about the arrival of the third wave of COVID-19 have been spreading. For example, this video says that a 56-year-old Mr. Zhao was hospitalized after suffering an acute cerebral infraction. His daughter and son-in-law came back from out of town to visit. The next night, Mr. Zhao developed a fever with a temperature of 38.2 degrees Celsius or 100.76 Fahrenheit. His wife, who was looking after him in the hospital, also felt dizzy and feverish with a temperature of 38 degrees Celsius or 100.4 Fahrenheit. His daughter and son-in-law also had a fever and fatigue at the same time. The doctor advised the family of 4 to take a nucleic acid test. They all tested positive, and it was the third time for them to get infected. The department immediately organized disinfection and placed Mr. Zhao in a single room for quarantine care. The third wave of infection was triggered by the mutated strain EG5 of the new coronavirus, and it seems real. The percentage of infections is on the rise in many places, and the number of patients in fever clinics is gradually increasing.
科室立即组织人员进行消毒。
The department immediately organized staff to disinfect the room and put Mr. Zhao in a single room for quarantine treatment. The new coronavirus mutant strain, EG5, has set off a third wave of infections. The third wave is really here. The percentage of infections is on the rise in many places, and the number of fever outpatients is gradually increasing.
According to a report by Voice of America on August 25, 2023, a newly released study by a leading U.S. research institute shows that in early December 2022, the Chinese government abruptly lifted its stringent anti-epidemic lockdown measures without warning or preparation. As a result, the 1.4 billion people in China were left unprotected from the ravages of the new coronavirus, causing the number of deceased people to soar to nearly 2 million in the following 2 months. Recently, Chinese netizens also discovered the document titled 2023 First Half Year Work Summary from the Civil Affairs Bureau of a county in Guangdong Province. It recorded a 114% increase in the number of people cremated from January to May 2023 compared to the same period last year, according to the data. Another document titled Mid-Year Work Summary for the First Half of 2023 of the Civil Affairs Bureau of Chongguang City in Henan Province revealed that the number of people cremated in the city from January to June 2023 increased by 78.3% year-on-year. Earlier, the Department of Civil Affairs of Zhejiang Province had also released various data for the first quarter of this year, including the number of cremations at 171,000, a year-on-year increase of 72.7%. August 30th is the Zhangyuan Festival, known as the Ghost Festival in Chinese folklore. On this day, many people will burn ghost paper in the streets and alleys of Beijing to pay tribute to their deceased relatives.
今天是中元节，也是大家俗称的鬼节。
Today is the Zhangyuan Festival, also known as the Ghost Festival. There are many people burning ghost papers in Beijing tonight. If you look at it, it's a sea of flames. So there are a lot of people burning paper on the streets of Beijing tonight.
这一天主要是祭奠逝去的亲人，为他们祝福，为他们送点纸钱。所以说，北京街头今天晚上烧纸的特别多。
我内。 这是不是有点乱呢？够热闹的啊！闲人们找不着我不要紧啊，你慢慢找，我给你定个位。